Welcome to Effective Change, a podcast sharing the journeys of people who have creative social impacts. At Effective Change, we question the meaning of effective social impact and find out how these leaders have found their own ways to run a socially impactful organization.
Hi, I'm Natalie, and we have Consuela here today, and we're hosting today's episode. We hope everyone's doing well wherever you are. In this episode, we'll be speaking to Duaa, founder and strategic lead at House of Pebbles. Based in Pakistan, House of Pebbles provide mental health sessions, in-house sessions, therapy, online sessions, and community well-being sessions. So Duaa, we are so thrilled to have you joining us on this podcast.
Thank you. Happy to be here.
Right. To start off, we'll be asking some quick-fire questions to know Duaa a little bit better. So first up, describe yourself in 3 words.
I am calm, sometimes anxious, and hippie, I guess. Yeah.
Amazing. I love them. Second question. So do you think social impact is measurable?
Oh, for sure. For sure. It's measurable. It can be quantified and you can see the impact of it. You can definitely see that.
Amazing. We'll probably have a better discussion about this later in our podcast. And thirdly, who inspires you and why?
I think my co-founder, my sister, inspires me a lot. Whenever I feel like I'm just stuck in a rut, I see that it's a funny thing that we never got along in the early years of there was a whole sibling, there was an adjustment period, I would say. But now that we also run this startup, I think she inspires me every day with her wisdom of what she does. And as a women leader and somebody who I look up to when she just sprinkles magic in everything she does. Yeah.
Amazing. Thank you for sharing that. I know I've introduced you and House of Pebbles, but in your own words, could you tell us about what House of Pebbles is doing?
Okay. So House of Pebbles is basically came out of the need of why we need literally physical spaces in well-being and wellness in Pakistan, in Karachi, the city I'm from. And House of Pebbles basically provides mental health sessions, in-person and online, community sessions, group work, group therapy to anybody part of the community and looking for healing, looking for guidance and to improve their mental health. Yeah.
Amazing. How did House of Pebbles actually come about? Like with your sister? What's the story behind it?
All right. Okay, brace yourself. So I did my undergrad from Pakistan, Karachi, and then I started working in the developmental sector, worked with a nonprofit, developed their mental health framework. It might sound odd to people who are from developed countries or at least have like some basic mental health services in place from the government or like any systems. But in Pakistan, there is not much to begin with. Even doctors don't really have that mental health training. There were a lot of things that kind of started building up in my understanding of why mental health in Pakistan just doesn't require a single therapist or a single psychologist sitting in a clinic and trying to take clients. It won't work that way. And I kind of transitioned towards the idea of system building and making systems and making organizations and like trying to create a collective of people who align with the same values that I have, which is basically ethical provision of services. Mental health should be taken care of by reliable people who know what they're doing, because there's already a stigma around it. So all these small realizations and insights inspired into that my sister was looking for a clinic. She's a psychologist, she's a psychotherapist, and she was like, I want a space, and she was just looking for something that would work for her. I'm the from the yin and yang and from the that part of the team that would be like, okay, let's go big or go home. So I was like, okay, let's look for a bigger space, maybe 2-3 rooms or 3-4 rooms. And then out of nowhere, it started developing into an idea of like a safe space for the community. And then because she was working one-on-one with people and trying to learn what they need, what kind of setting. It's a very small thing, that what kind of a room they would like to enter when they want to talk about their emotional stuff. And then from there, I was also transitioning towards community psychology and community work, and how just being in a room with your therapist and talking about your emotional stuff won't really create a huge impact in a community member's life. It should be also community engagement, also group work for people to heal, but also then connect with people. It shouldn't be in a silo, like isolated. So from that point onwards, we started to talk about the name House of Pebbles. And then we started focusing on what do we want to name this venture. Then we started looking for a space, and then we started looking for what the values, what are the values that we want to resonate or reflect back in this venture. And that's how, maybe out of nowhere, this idea came about. And then we started working on it in end of 2019 or early 2019.
Amazing. Thank you for sharing that. I think what I love that you mentioned was the isolation. It's about healing and connecting people. I think that's completely right. I think particularly having started in early 2019, before the pandemic started, how do you see a change, like in terms of what happened before and post-pandemic?
Nobody was ready for that, right? And if you think of like a small startup business community organization, that was literally a brick. The USP or the value that we were bringing was a physical space. And when the pandemic started and there were lockdowns everywhere, it was a really big hit to our morale as well, our focus and what we were trying to do. But at the same time, we were perceptive towards, okay, if not this, then what are we planning to start off with? I think everybody started this. We started working on online engagement a lot, and maybe that was something that was destined for us, because that was those 3-4 months were very keen for us to do awareness work. And since everybody was online, House of Pebbles picked up like anything, and everybody in the mental health sector, and since everybody knows everyone, it went like anything. People knew us and they were talking about us. It was to the point that a lot of my interns were saying, please introduce yourself on the startup, because everybody knows the name, but they don't know who's creating all of this. So we had to like purposefully announce that these are the co-founders because everybody started talking about it, and it ended up being, okay, let's just like now share who's behind this idea. So the pandemic did one thing that was difficult for us, which was using our physical space to amplify our work. But what it did, and I think it was a blessing in disguise, what it did was shift the conversation towards the online engagement. And that really helped us create that sense of safety, helped us understand what's the requirement of our community. And when I say community, I've always said that my community is growing by one person at a time. One person at a time, we were trying to make an impact and talking to people and like getting therapists on board online to provide services. And it was a very interesting, fast-paced pivot move of ours, that through the pandemic, we'll also provide online services, which was never the case for this startup. But the online thing really helped us creating that impact for sure.
Great. And I love how you mentioned that you guys at the start didn't really brand it with yourself. It's just a community that you're creating, and then you have to put it forward. I think that's quite interesting. I think a lot of the times people would do it the other way around. It's great to hear that for your case, because you guys are getting so popular. People are asking to find out who are these people that created this amazing community.
It's interesting because I really like working with young people, really people who are like fresh out of undergrad or still in their undergrad, really passionate about making change. I'm more of a person who reads energies. So I started developed this internship program, started working with people. It's interesting that and these were my interns who suggested that please introduce yourself, because me and my co-founders' goal was to never associate or primarily attach our name with the change that we are trying to make. And it was very consciously done, unless there was a need, which was clearly pointed out to us that please introduce yourself. But even now the approach is to talk about the change more, to talk about the need more than actually to talk about who's doing it. I think that's one of our very intentional ways to say that we want to work on the sustainability of this idea, rather focusing on the branding of this idea.
I love that. I think it's very rare nowadays to see that side. I mean, the fact that it was through a strategic element that you guys wanted to create this community and have the voices as a whole rather than from you guys. I really like that. And I think one element that you mentioned, that 1% growing your community, 1% at a time. And it sort of echoes with the baby steps that we all are taking in our own lives to make a change, either within our social circle or beyond that. I was wondering, like, mental health being quite a taboo topic still in particular Asian countries, what sort of other challenges did you face throughout your journey from early 2019 to now?
That's another approach that we intentionally take and talk about, is that we, or me, I guess, I see it that, hey, it's a taboo nobody wants to talk about. I don't want to talk about the taboo. So the minute we say that there is something negative or something that there's a hurdle or a challenge, I don't know if it's the right approach or not, to be honest, but this was very intentionally done in the early period of House of Pebbles, that we will be talking about it and persevering through the taboo without even talking about that it's a stigma. Because the way human mind, or my understanding of human mind works, is that if we constantly say that mental health has a stigma and there is difficulty around it, we're going to be focused more on the stigma part of it and not on how do you actually change it, right? We're not going to focus on the solutions bit of it, or talking about what are the different ways you navigate around that taboo. And it works the same way as you're trying to solve a challenge. You become creative, you become innovative in what you're trying to do. And one thing that, to answer your question, one thing that we did was intentionally not talk about that it's not being talked about. We were taking the approach of, let's talk about this, let's talk about that. And it's almost like how a normal human conversation works, right? If I end up asking Natalie about, hey, how are you doing? Do you feel rested? How was your weekend? And we intentionally talk about our weekend. So it's a very human, very basic approach of how sometimes we end up forgetting in all that marketing gimmick and all that bougie approach of making a change. So one thing, make it about what we are trying to change. And that's what we did even on our social media. We try to bring up topics that we feel that, hey, maybe this is something that people would be interested in a very similar fashion. Like you guys said how you wanted to create the podcast. And also I think one of the challenges was that for my community, a lot of times, or for people who are associated with the House of Pebbles, mental health does not have to be very serious. It can be in every flavor and fashion you want. Sometimes you need to also see that mental health can be fun, humorous, colorful, and energetic as well. So we kind of like now that I'm talking about, we kind of like wanted to brand mental health in a different way. And that's what the first challenge was, to like unwrap that whole thing. The second challenge, which was a massive challenge, and I think that is something that we still struggle with, is once we do the awareness bit, after that, we also have to recognize it's still a bubble that we are creating, and it's still a bubble. And it's a very slow process of the going to therapy. And even if somebody doesn't want to go to therapy, because sometimes therapy doesn't work for some people, some other healing tool works for people, but it's a very slow process. And the challenge for us is to be patient with that, to be very, very patient with the change that we're trying to create. It's going to be slow, but it's going to be profound. And this is something that we are maybe, let's say, the second stage we're kind of addressing and trying to work towards, is that how do we not speed it up, but at the same time, how do we multiply and amplify that change and ask people to work towards healing in whatever manner they would like to.
Thank you for sharing your challenges. I think amongst all these hurdles, I'm curious, as the co-founder, as strategic lead, being in such a leadership role yourself, how do you manage your own setbacks?
Yeah. Okay. It's quite a journey that I've gone through for my own mental health and emotional health. I have, even throughout the how we founded House of Pebbles and everything, I think one of the challenges is to also maintain that semblance of sanity. It's for me, it's like if I'm not being able to handle how I am functioning, then that's the first step, right? I think I've learned to take a step back to get some perspective and go back. And I think one of the things that I feel like is to not jump into something that I'm not ready for. And it could be a very slow process. And I'm a huge supporter of slow processes. Let's take our time. It's quite the opposite of what the world is doing. So I feel really isolated in that. Let's take our time. There's no rush, no hurry to do that. And that helps me really get some perspective, go back, see what we're doing, and then come back. So yeah, that is one of the approaches that I do to take care of myself, understand what I need in that moment.
Yeah, no, I definitely agree. Even the sort of side projects I'm working on at the moment myself, my team and I, we're taking it slow, but also reminding ourselves that have fun. We went on this journey with a vision to hopefully make that impact, but we ourselves need to have fun exploring the different things and pursuing for that, that ultimate goal. So I definitely agree on that. And Duaa, last question for me here. Would you say it's a hybrid form between the online aspect and the physical space? I guess, how do you actually see House of Pebbles evolving to make mental health more accessible to people?
I think context really matters here. Back in Pakistan, as I said, I always feel that mental health is still a bubble, is still vacuum that the one person that gets added, it's entering a room and nobody knows about the room. Like, so the impact is it's slow and generates with time. With the impact that House of Pebbles is aiming towards is that we definitely need a lot of physical spaces that people can go to and feel safe. That is the first thing. That is technically how human psychology works. If I'll constantly message you, hey, I'm here for you, but never really show up, it doesn't really work that way. So we need physical proofs of spaces that we can show to people that this is a space that you can go and talk to people. It's almost an evidence of the work that mental health can do for you. And I feel like maybe in the future, 5 years down the line, I want to see not just House of Pebbles, but in terms of the entire mental health sector or service industry in Pakistan, to have as many spaces for people in Pakistan so people can associate. It's almost like an association of, okay, this is a clinic, a hospital, whatever you want to call it. This is where we can go and heal and talk to people. That is the kind of impact I'm looking for. I'm going to go against what the world is currently doing and say that online is not really the solution of mental health and therapy. The humans in the most basic fabric require connection, touch, very kinesthetic that way. We kind of like forget about all the basics and try to think that we're too smart and we're going to do VR and AR and this and NFTs and this and that. But in the process of it, we complicate it and forget about our most basic instinct, which is connection. That also is a very key focus of House of Pebbles as well, that we want to connect people, and it could be through any medium and format. So yeah, the next goal would be to see as many spaces as possible. Yeah.
Amazing. I definitely believe in the thing you mentioned about connections and how, even though we're in a time where everything's moving online, but it's that physical interaction that makes things, so much better. Because I think even since birth, we have that physical connections with our parents, and it's these little elements that it's some within our genes that we need some of these connections.
It's you can't really bypass it, right? You can, but you cannot. It's almost like we are very smart as people, but we cannot outsmart our needs. How do you do that? I don't know. No matter how much capitalistic or advanced or technology solutions or whatever fancy word you want to use the world goes towards, you can't. You need that.
No, I think we can all agree here that connection is like human nature, not even human, just animals, anything and beyond. Like, we're all part of this ecosystem, this world where it's like connection, it's quite abundant. within us. But yeah, over to you, Consuela.
I had an idea that I want to discuss with you because I've been thinking about this a lot. You know, whenever you are in the super busy district of city, say London, think about, you know, people walking so fast that they will get angry at you if you know, happens to stop or something like that. And we always feel so anxious and rushed, you know, the mentality nowadays, get things done now, efficiency. I always want to find a space where I could just chill, you know, and be myself and just or spend some time by myself. I know cafe is an option, but I don't feel like sometimes that satisfy the almost, I don't want to say spiritual, but more that kind of like a higher elemental need for a break rather than just being constantly bothered noises and everything. So I would love it if I can create some sort of oasis in the busiest part of a city where it's not like a hotel, but where people can, you know, rent a room and just go inside the room and sleep for an hour or just sit for an hour or just read in a really quiet space where they feel like they can really recharge rather than they have nowhere to escape. Because when I was in a city, even if I go back to my flat, I still feel like I'm still being bothered by everything. Yeah.
One of the things that we did very intentionally was how do we design the space that we were aiming to make, which eventually we called it House of Pebbles. And there as well, we used basic human psychology. I'll share the space pictures with you guys as well. There, for the individual therapy rooms, we used calm colors. And for the community room, we used really energized red, yellow colors. And other than colors and the interior, how we got it designed, one thing that we intentionally do is, as you said, an oasis of calmer energy, basically, to like remove all the clutter, noise that you're facing from the entire city, your house, your home, your loved ones, family, whoever that. And the clutter could be anything, right? So we have gotten this very interesting feedback from all our clients so far, is that when we come here, we feel lighter, we feel calmer. And one thing that, even though design also helps tremendously, one thing that has helped us is, what is the energy of this space? And energies do really matter. Is it a safe energy? Is it like a calm energy? And that is the energy that our team, internal team, all our coordinators, admin team actually function around that energy. And one thing that we really, and it's a very basic thing. One thing is that our tone of voice is on a very low decibel. It's very low. And if anybody starts laughing like really loud or like being loud, somebody is reminding them just to like tone. And it helps, because what happens is that the person who's entering here is going through a ritual of safety, in a way, is going through a process of, hey, I'm going in that calmer zone. I'm going in, if the person was in a fight, flight, freeze response, or was very agitated and will be talking to their therapist about a certain, let's say, a disturbing thing or like stressful thing. How do we prepare them from that when they enter the door of the space towards that room? And from there, the therapist then takes over. So it's very intentional. But I think, to answer your question, it could be very well anything. It could be just like a simple room. All we have to, in my understanding, is maintain the energy of that room. And what is that you want to manifest and send it out in that room? It will not be possible with people who would be anxious themselves or would be on a higher energy level. So it's always mindfully thinking about what is that space that you want to curate and you would feel safe, and then maybe include people in it. And that could be a room, could be a bench, or could be a park, could be anything. And as long as you just like create that space, basically.
I love the idea how little details can have a massive change or a shift of perception almost. Even sounds. I remember, I think I was doing a yoga session where they have these really nice bells and where they kind of ring it. And it just immediately reminds you kind of, okay, just focus on the sound now and then ignore everything else. You're entering a different space right now.
I always say that humans try to outsmart the most basic things, and we cannot. And that's where a lot of mental health issues are deeply rooted as well. Sound is such a blessing. sound and anything tactile or anything is such a blessing for us to ground ourselves and come back to the present. No matter which space we are in, it helps us coming back and kind of like being in touch with our humanity. I'm fascinated how easily we forget the most basic things. It's very, very, very interesting.
I'm wondering also, because we've been chatting about so many different ideas, and also I feel like it's important to be aware that mental health is super diverse, that there's not just one type of mental health, and it's like what you were saying before, it's not just sad, it can be also energetic and maybe chaotic and happy or different way or colorful even. How do we measure your kind of impact, the kind of mental health impact you're creating? Because I feel like it's such a huge concept and also like a really diverse concept.
I'll give you an example of, let's say, a basic therapy. A person who is seeking therapy and goes for a really, let's say, a clinical issue to a therapist and says that, hey, I need guidance for this. In the most basic fashion, in the initial period, the support that the therapist is providing is very, very frequent. It can be twice a week even, or every next day. Sometimes it's so that the client can then pick up themselves and also start maybe venting out. And then after some time, based on whatever insight the client is developing, those sessions then space out to, let's say, once a week. And then after some time, it's twice a week. And then after some time, it's on need basis. It's a very simple form of saying that it's working, that the client is getting that insight and support and cognitive templates or cognitive guidance or coping mechanisms that they earlier didn't have. And the therapist, as a supporter in the process, as a clinician in the process, is providing them that insight for them to now maybe use an external guidance less and less and less, and be more independent of their life and their emotional processing and expression. That's the most basic form of measuring it. If you want to talk about it from the perspective of how do you measure it from a collective sense, we measure it through tests, we measure it through questionnaires, through, for example, focus groups, that what is working for you. There's an organization back in Pakistan called IRD, Interactive Research and Development, and they recently did a theater-based workshop, and this is part of their research. And they did these focus groups where the participants were either caregivers of people who had psychosis or people who had been diagnosed any, for example, psychotic disorder, or from that same vicinity of issues. And the workshops were to build insight and to show the participants that, hey, if this happens with this person through theater, through acting and enacting, how would you feel? And what are the things that you have come across when your loved one goes through it? Or what are the things that come across when you were dealing with a client of similar issues? And through these workshops and trainings, we can definitely understand at what point the population is standing in terms of insight of these issues. And then we can take it from there. Okay, maybe we want to talk about awareness more, or maybe we want to talk about what is the intervention, what are the services, what are the platforms that you can access, or maybe even like a last bit, who wants to go to these platforms and how they would be using it. Sure.
Do you think that social impact is in conflict with profitability? Or maybe the better way to frame this is, what do you think is the relationship between profitability of running your organization and the social impact it's making?
I think when we place two things right opposite next to each other, and language matters here a lot. I see that how we place, like, just as I said, that mental health has a stigma. When we constantly say that, the human mind does not get through that challenge. So I don't really say it. In the same way, I feel like mental health, I've not seen, or I've not heard much, and I might be an incorrect assumption, but when we say about health and treating people with COVID or treating people with diabetes, we don't really place it in terms of social impact and, let's say, a business model. It's just health. We don't really place it right next to each other. It's difficult to make money out of treating diabetes or COVID or heart diseases or cancer. We always it's never the conversation. Like, in the similar way, when we talk about what the world calls it social issues, and it says that we wanna reduce waste, or we wanna reduce poverty, or because the constant focus is on that, it's a problem, and it's a hyper focus. It's almost like the human psyche is going in an overdrive that it's a problem, and you're not really moving around it. We cannot acknowledge the fact that there is an opportunity here of addressing the problem, and it's a constant cycle of going in our own cognitive vicious cycle of saying that, how do we come across it, how do we focus around it? So for me personally, what works is that I would say, I'm constantly saying that mental health may be a social impact issue, and it can definitely impact a lot of people, and it can be placed there, and I would definitely not place it in the same manner. I'll give you examples. There are a lot of platforms that are growing and have 25,000 therapists, and there's a huge demand of mental health as well. Let's completely shift the narrative towards that hey, there's an opportunity of people are actually struggling through mental health, and what are the creative ways to do that? And I think one of the things that design thinking says that if you see it very contextually, that what are the issues that you are trying to solve, then only you would be able to solve them, rather assuming something like that. It's framed like that, and we want to address it like that. So I feel one key part of social impact should be that let's not make social impact a sad sob thing. Maybe social impact is the new opportunity of a new global opportunity for us to, because if there are no problems in the world, then what are you trying to solve? So there are problems, right? So I think social impact should be viewed from that lens.
I really relate with the part you were saying, how when you just say it's a problem or it's a challenge, because I do it all the time because I feel like I definitely firstly struggle with confidence. So when I see something that I doubt myself about, and I'll be like, oh my God, this is going to be a huge problem. This is going to be a huge, challenge. I need to overcome it. But then when I say this to myself more, I just kept on thinking, oh, maybe there's no way around it. It's just like a stone there.
It's quite a glimpse into what human psyche is and how at a global scale we're looking at things. It's almost like that. It's almost like some people do say that mental health issues are gonna go up. So the thing that what matters here is what is the language that we are talking individually, and what are the things that we're talking at a collective scale as well.
So my final question is, how do you have any tips for, aspiring entrepreneurs or people who are looking really people just like me and Nat, who's trying to look through a way to actually change something, making a tangible impact, and maybe we don't know where to start, or maybe we have very limited opportunities or resources or time, but maybe we can't even start an organization yet. Maybe we can just do something in our daily lives, what it is that we can do.
I think I'll approach this question with what I have learned that has worked for me and might work for you as well, is that when we want to change, and this is a very cliche thing I'm about to say, please kick me out of the room once you hear that. When you want to change something, you need to have the courage to also change yourself in the process of it. And what I mean by this is that we need to give ourselves a lot of time to channel those thoughts and filter those thoughts and clarify those thoughts first to ourselves, and then see what change we are trying to bring. And in that process, I think what is absolutely required and what will happen eventually, and happens to every person who wants to do massive things, like wants to create change in any way, is that they also go through an evolution. They also go through the process of change. So one key thing that for any person who wants to make an impact, small, big, or however, is that they need to also open themselves up for change individually on a very emotional, on a very basic level. And I think what has worked for me as a technique is that I try to give myself a lot of time, as much time as possible, because that helps me understand that, okay, where is this stemming from and how it's motivating me or igniting that fire in me. And if that's clear, then only I will be able to move towards the next step. So yeah, change within you can translate into change out there in the world as well.
I love it. I love it. It's like be the change and be open to the change. But also, I feel like one of the most important message I will take away is that take your time, because including me, everyone is always like rushing to do things. And then hopefully change will happen if we keep trying.
I think one of the key things I'm taking away from this conversation doing it's the pace that you decide how you want to live sort of your life, your daily life, and being reflective, being self-aware of the pace that's right for you to understand yourself and have the courage to change, and hopefully plan how to make that change and amplify the effects. I think often as we're coming out of COVID, out of lockdown, having more interactions with people, we often just rush ourselves. Oh, we're now open to do anything. Let's do this, let's do this, let's do this. But we don't ask ourselves enough questions of like, why are we doing it? What are we trying to actually gain out of it? What sort of impacts? So no, thank you very much for sharing that. And thank you very much for coming on our podcast.
Absolutely.
Thank you.
You can now find us on Anchor and Spotify. If you like our discussion, please follow and share. Don't forget to follow Effective Change on LinkedIn and Instagram for exclusive updates and inspirations.